Hello team, I'm Will, this is Hannah. We're going to walk you through another Kinstretch class. Today we're going to be focusing on hip internal rotation, such an important piece of having enough space to move and be strong and do whatever you want to do with your hips. So to warm things up, I'm going to have Hannah come into a side lying position and just get comfortable. She's going to find a way to brace her body against the floor so that she feels some contraction through her midsection. And then she's going to drive her top leg behind her back into hip extension and look for a stretch across the front of the hip. When she finds that stretch, start to elevate the shin to the ceiling. When you can't elevate anymore, she's going to bring that leg forward. And she's doing a really nice job of keeping her spine from moving, even as she explores the largest circle she can with that hip. Go ahead, do another rep, driving that heel all the way back. As you notice the stretch, also notice the contraction on the other side of the hip. Okay, so you're feeling both active effort to pull you into each position, but also the lengthened tissue, that stretch feeling. All right. When she gets knee to knee, she's going to take a moment to breathe, check her brace, and then start going the other way. Thigh to stomach, shin to the ceiling. Start to reach the heel behind you. And she's doing a nice job of really working for each part of the range. If you notice that there are any pieces of that circle that sort of go blank for you, or that you're not sure what's happening, it's a great opportunity to just pause, check your brace, try to learn a little bit more about that position, and then keep going on your way through your rotation. All the way around, making our way back knee to knee. Okay, and then go ahead, flip on over, and we'll do the other side. So just to give you some idea of other braces, she's using the one pushing to the floor, but if you would, try pushing both hands out in front of you. I'll give her a little block to put her head on, like that. Okay, and for some people this feels a lot better, might feel easier on your neck, or it might just generate a little bit more tension through the midsection. All right, let's go for it. Drive that heel behind you. When you hit end range, start to sweep the shin up to the ceiling, smoothly arcing that thigh forward into hip flexion. All the way around, trying to even reach the knee towards the bottom knee actively as she sweeps through and does a second rep. Okay. Keep going, trying to feel contraction at every angle. And I'm just looking here to see if she's turning towards the ceiling at all, and I don't see any turn. Really nice job. It's very easy to let your pelvis roll back as you try to reach your foot back. So keep those hands heavy into the floor. Keep breathing around some tension that you've noticed in your midsection. And follow up for a final rep. Pulling that thigh to the stomach. Reaching the knee, shin, and ankle to the ceiling. Smoothly connecting that to a reach behind. Feeling the back of the hip really contract to pull you into more extension, and finishing up stacked knees. Okay, all right, now I'm going to ask Hannah to come into a 90-90 position. This is such a great way for us to work on rotation. And at home, we're going to ask you to be near something that you can lean up against. So this is our version of a couch, but I think a couch works actually the best, nice and comfortable. And start about a foot away from the couch so you're not right up against it, but you have some room to lean into it in a moment, okay? So we're going to be working on internal rotation, meaning focusing on this back hip. And just to make sure that the front hip isn't stopping us at all, go ahead and bend your front knee. There we go. Just to whatever's comfortable for you. And then you can see Hannah has her hand on her back hip. We're going to just start to try to explore how this position actually gets you into rotation by just beginning to rock the hip forward and back. So as you rock forward, try to squeeze your glute all the way forward so you can open up the front of the hip. And then as you rock back, try to reach your butt towards the floor. And the result is rotation at your hip joint. Your thigh has rotated in comparison to your pelvis. Okay, so really just start to notice that rotation. Another place you can notice it is just by putting your hand behind your back and feeling your low back Your low back is going to try to pretend to be a hip joint. And so we want to just feel that motion at the hip socket while the back stays relatively fixed with itself. It's not flexing or moving. All right? So go ahead, do one more. Really actively drive your hip forward, squeezing your glute. And then as she sits back, she's going to look for a twisting stretch sensation in the hip. Okay? And then go ahead and lean back a bit. If you have to scooch towards the couch, you can, because now we're after a passive stretch in this position. So just settling down into it. Now, quick aside here while Hannah's relaxing. Hannah has some otherworldly hip internal rotation.
This is true.
I do not. So I'm going to look much different. I'll show you. When I get into this, I don't get my hip anywhere near to the floor, like Hannah's pretty close to the floor. But this is why it's so important for you to search out your amount of internal rotation. Okay? So Hannah's going to just relax here, maybe even close the eyes and just start breathing. I'll just give you about 30 more seconds of trying to let your body relax into its most internally rotated position at the hip. So a nice full relaxed inhale all the way to the stretching area. And then as you exhale, try to let any tension you feel out through your breath. Great. One more nice relaxed inhale and exhale. Okay, so as you breathe out, settle into this position. Okay, now you're going to take a breath in to pack some tension into your abs. So take a breath, kind of compress that air a little bit, and feel your body brace so that now I can start to cue a Pale's contraction. That's going to be where we start to rotate the thigh so that the ankle and the foot get heavier into the floor. As you start to notice that, just light at first, you might also notice your knee trying to come off the floor. So as you push your ankle down, also start to push your knee down. Okay? And as you're starting to add more and more tension to this, you should feel that tension starting to spill over to the rest of your body. So let's say Hannah's at about 40% tension now. Let's continue building up to 50% tension, 60% tension, 70% tension, and we're going to park it right there at 70%. Really try to hold on to that effort. Don't let your body flag at all. Don't let any part relax. If anything, add parts of your body to the mix, holding it for 10 more seconds. Really trying to load the tissue that you were just stretching. 3, 2, and I'm going to have you relax back into that stretch for this first round. After you do that first Pale's contraction, you might notice an ability to settle deeper into the stretch. And remember, this has a lot to do with what you're feeling. So let's say in this position, Hannah was just really feeling an intense sort of a pinching pain here. Then you might need to lean back a little bit. She might need to lean back. On the other hand, if she's feeling a very clear twist, after that Pale's contraction, she might be able to drop into a little bit more twist. Okay? The other spot to keep an eye on is that bottom of your knee. If that's bugging you, you can try sneaking a block under there, but I think Hannah's fine.
Like a
Okay?
towel.
Yeah, towel works well as well. Okay? Yeah. All right, let's do another quick follow-up on this side to learn the rails contraction, the other rotation. So again, Hannah's going to take a breath and brace some tension into her abs. And now she's going to direct that tension into rotating her thigh in the other direction. So trying to think about making the ankle and the toes light on the floor, but really committing to not letting anything move at the pelvis. As you get a feel for that, start ramping it up a bit quicker this time. So you can ramp it up to 50%, 70%, and all the way up to your greatest safe effort of rotating your hip into more internal rotation. Try to get as many muscles involved around the hip as you can. 4, 3, 2, 1, and melt into that stretch again. Good. Take a moment to just feel relaxed, and then let's go ahead and set up on the other side.
Good.
Nice job. I've found that often when you work at end range, it can feel a little like almost tweaked when you come out of it. Like, oh, was that quite right? But the whole point is that we're really going to be opening up range that your body is not used to using. And we want to bring it into the mix. Get it part of the party. All right, so in 90-90 here, front knee is bent. Back hip is going to start rocking forward and back. Give it a few chances to feel that rotation in the hip. Remember, we're after a twist on the hip. Okay. Try that hand behind the back again, just to bring more awareness to that part of your body where we don't want to try to flex or round in the spine. We want to try to just rotate at the hip. Okay.
They could lean during this part?
Yeah. You could go ahead and lean back as well if it feels better. But on this next one, let's settle into your most rotated position. Lean back, relax into it, and just try to start feeling what tissue is restricting you from going further into rotation. Okay. So we work on rotation quite a bit, and there's always the question about why rotation. So while Hannah's doing some deep breathing and relaxing here, I'll just give you a quick sound bite about why. Basically, it's because the tissue that's the deepest on the hip is rotational tissue. It's tissue that's focused on trying to rotate your hip in this case. So if there's any restrictions at that deep level of your hip, then those restrictions are fed outward into restrictions on the more superficial parts of your hip. So before we want to go after the superficial stretches, we want to make sure that there's enough space deep in the hip. And that's why we focus on rotation first. Great. Go ahead, take one more nice inhale. Relax as much tension out as you can. All right. Now commit to keeping this position as you take another breath. Pack that air. Okay. And then with only 1% added effort, start to push your foot into the floor. So it's 1% heavier. Start ramping up that intensity now. So you're starting to push the foot into the floor with 10% effort, 20%, and try to build 1% at a time, making sure the knee is still pinned down, but really thinking about rotating your thigh so that your ankle would sweep through the floor if the floor wasn't there. Okay? Ramp it up through 60% effort and 70% effort, holding it right there. Now, maybe you can't see this at home, but I can tell that Hannah's shaking just a little bit because she has enough brace in her midsection that this is a real effort for her nervous system, even though she's not moving. Go ahead, hold it. 5, 4, 3, 2, great effort, and relax into that stretch again. You might notice a little bit more rotation is unlocked, and you want to take advantage of that. Okay. And now we're going to brace again, nice and tight against the couch or whatever you're leaning against. And then start thinking of rotating your thigh now the other way. What would the muscles be involved to make your ankle feel light on the floor? That's what I want you to ask your body right now. As you start to lock onto that sensation, send more effort in that direction. Use all the muscles you can in your body, squeezing your fists, breathing around the tension that you feel, and hold that rotational effort at your greatest safe tension. 5, 4, 3, 2, and melt yourself back into your stretch. Great. All right, let's go ahead and find the first side. Come on back. Now we're going to train that same isometric effort, those pales rails. We're going to train it again. This time, it always feels different when you come back. So it's definitely going to be a different experience. Stay open to those new sensations that you might be able to find. Stay open to the possibility that you might be able to find more rotation, or maybe not at all. Maybe it's the same exact setup. Okay? So the only change to this second round is that we're not going to hold a long passive stretch. We're just going to get right into it. So go ahead, take a breath, and brace that midsection. And direct that brace into start making your ankle 1% heavier. With that heavy ankle, you should start to feel a rotation on the thigh and start to add heavy knee as well as heavy ankle and toes. Ramp that effort up to 30%, 40%, 50% pales effort, 60, 70, smoothly adding effort to the mix, go all up to 80%, and greatest safe effort. Bring it all the way up to your greatest safe effort. 3, 2, 1, relax. Good. Nice job. Okay, brace again. Use that little bit of tension in your midsection to start locating the opposite direction, the other direction. Start feeling your ankle trying to get off the floor, but it won't be able to pick up. Send more contraction into the muscles you feel rotating your hip and bring it all the way up to your greatest safe effort right off the bat. Find that effort, hold on to it. If you start to cramp, try to work through that cramp. 3, 2, 1, and relax. Nice job. Okay. Now on this final rep, we're going to just do one little change, which is to put the rails right after the pails. So when I count you down from the end of your pails, you're going to switch right over to that greatest safe effort in rails, trying to make your ankle light. All right, here we go. Brace your abs. Good. Use that brace to make your ankle 1% heavier into the floor. Add to the mix your knee staying heavy on the floor and start ramping up the effort through 20% effort, 40% effort, 60% effort, 80% effort, and all the way to your greatest safe effort. How big a dent can you put into your floor with your ankle and your knee? 5, 4, 3, 2, you got this, Hannah, 1, and now rails contract. Right off the bat, try to rotate the thigh the other way. If you feel the beginnings of a cramp around the hip, try to lean into that sensation. 5, 4, 3, 2, 1, and melt it down. Good. Hannah's working here. Take a second, let your nervous system just relax. Isometrics are sneaky in how difficult and challenging they are for our nervous system. So you got to just give yourself a little space to recover. All right, and then go ahead, flip on over to the other side. Flip it. Just flip it on over.
Really funny choice of words. Okay.
All right, here we go. So again, noticing how this side might feel different from the other side, but also different from the first round. All right, settling into a stretch. All right, and play a little bit. Hannah was doing some fist out to the side for her brace. She was also doing some against the floor. You might also find like leaning up against your prop support or grabbing a buddy next to you. Yep, bracing against your own body. You just want to explore a little bit and notice what sensation makes you feel the most stable. Okay, so here we go. Let's pack some air into your abs. Brace your body. Start using that brace to generate 1% extra weight into the floor with your ankle. From 1%, smoothly hit every percentage point up to 20%, 30%, making sure the knee stays pinned to the floor as well, 40, 50, 60, constantly thinking rotation, 70%, 80%, and all the way to your greatest safe effort. How heavy can you make that leg in a rotational effort? 5, 4, 3, 2, and melt it away. As you relax that tension, feel the tissue able to lengthen a little bit more. Find that little bit more space in internal rotation. All right, now we generate a brace again. Start thinking the opposite direction, thinking your rails contraction. What effort would make your ankle start to get light on the floor? As you locate that effort, go ahead and ramp it up all the way to your greatest safe effort. Hold that effort. Give me 10 seconds of great quality effort. 5, 4, 3, 2, 1, and relax. Nice work. Okay.
Almost cramped.
Almost cramped. Yeah, so We want to, obviously, if something actually cramps and you have to get out of it, that totally makes sense. But anything short of a full-on Charlie horse, wake you up in the middle of the night cramp, I want you to try to work through it and let your brain get a little bit more effective in this position. All right, last rep for our pails rails. This time we're going to do the rails right after the pails. Get braced. Use that brace to generate pressure through the ankle to notice rotation on the hip. Start ramping that smoothly through 20% effort, 40% effort, 60% effort, 80, and all the way up to your greatest safe effort. Wherever you get to, hold it right there. Don't let it drop by even 1%. 5, 4, 3, 2, 1. Rails contract. Pull yourself deeper into that rotation. Try to look for a stretch while you're contracting your hip, making your ankle feel light. 5, 4, 3, 2, and relax it. Very nice. Again, just let your nervous system come down from that peak, melt down into the stretch, and then gently make your way out of that position. No flipping. Okay. All right. So when we're working all the way to the end range position, we want to take care and not do any movement at that end range position. But then once we've cleared out as much workspace as we can at the hip, we want to start training right inside of that end range so you don't have that like kind of tweaky feeling. Your brain feels comfortable in this position. So this time scooch a little bit further away from the support so that it's there if you need it, but it's also not going to get in your way at all. Okay, and what we're going to work on first is just to start to feel some active effort to introduce movement. So I'm going to ask Hannah to turn again her hips square ahead. Try to squeeze the glute on this back leg to square the pelvis towards the front knee. All right, and you can see from the side here that her back is not turned at all towards the camera, but is square ahead towards the front knee. All right, then from here she's going to brace against the floor. Leaving the ankle on the floor is going to start lifting the back knee and try to not let the pelvis turn. So just notice that first and then set that knee down. All right, so for these first 30 seconds, she's just going to lift the back knee, trying to resist any turning through the pelvis and smoothly setting it down. Really trying to notice what tissue is contracting to pick up that knee. Can she get any other tissue to help out? Maybe by making this arm a little heavier, maybe by keeping a brace even stronger. Good. Last rep, she's going to lift that knee only. Now to keep lifting the knee, she's going to allow the pelvis to start to turn, trying to think about prying this back knee as far away from the front knee as she can without letting the front knee move. So really trying to maximize that space. Great. Okay, and now as she starts to turn back, she's going to keep that knee as high off the floor as possible as she turns her pelvis all the way towards the front knee. Keep turning, trying to turn that belt buckle, letting that knee start to come down, but keep trying to turn the belt buckle and set the knee down. Nice, okay? I'm going to go ahead and try 2 more reps like that. You might have to pick up your right hand off the floor if you're moving your right leg. So making a fist can help remind your body to stay on tension. And really trying to pry the knees apart. Give yourself an inner thigh stretch if possible. And don't let that front knee come off the floor. As you turn back, your focus is first on turning your pelvis, keeping that back knee off the floor until the very end. Good. Set the knee down. Last rep, just make sure you start squared up each time. Brace. Lift that knee. Nice, Hannah. Good. Start to pry your knees apart. Not letting anything move except where you are specifically trying to move. Good. She does a nice job of finding a complete stop, proving to herself that she can't go any further, and then turning her way back, pelvis first, and then the knee. Nice. Okay. Let's go ahead and get the other side. Give that hip a little break. Okay. So same idea here, starting with the pelvis squared ahead towards the front knee. All right, sometimes you can squeeze your butt on that back leg just to feel the front of the hip open up a little bit. All right, first 30 seconds is just going to be focusing on a very small motion of just lifting the back knee, not letting the pelvis turn at all. Go ahead and start that up. Good. Up and down. Now the reason we're constantly cueing you to brace is because if I just asked Hannah to lift her back knee without bracing, it would be really difficult for her to feel what was moving. Okay, keep going. Yeah, this is great. Do a couple more here. I'm just providing that entertainment for folks at home, giving them little educational nuggets. Great. Okay, one more rep, trying to feel that lift of the knee without the pelvis. Good. And now this next one, we're going to start adding the pelvic rotation. So lift the knee. When you can't lift it anymore, start to turn your pelvis and spine, not letting the front knee come off the floor. That's your gauge. How high can you lift that back leg without letting the front knee move? Start to turn back. Try to turn your belt buckle all the way square before your back knee hits the ground, and then set that back knee down. Great, Hannah. Let's fight for 2 more high quality reps. Knee first, then turn the pelvis. Actively trying to feel both butt cheeks squeezed to drive those knees apart, not letting the front knee off the floor. Good. All right, final rep. Drawing that brace, using the tension from your midsection to direct controlled motion through that back leg. Try to give yourself an inner thigh stretch by contracting the back of your hips a little bit more. Turning, stay tight all the way to the end. No rush to finish. Yeah, nice. That's where you eke out that last little bit. Great work. Okay, now let's do one final drill on each hip. So go ahead and turn back to your first side. All right, so now we're going to go back to really thinking about rotation specifically. And if you recall, when we were doing the rails, I kept asking for you to think about your ankle getting light. Well, now we're actually going to do it, okay? So square your pelvis up to that front knee. Okay, so maybe squeezing your back glute to open up the front of your hip, all right? And you are going to need to lean forward a bit. Unlike before where we were leaning back, you're going to need to give yourself a little space to work here. All right, so I'm going to cue Hannah some bracing first before we start to move so that when the movement happens, it's very specific to what we want in terms of rotation. So brace both hands into the floor heavy. Feel that create a plank sensation in your midsection. Keep that plank as you start making your ankle feel light, just light. Good, just maybe hover it a tiny bit off the floor. Good. Okay, and then when you notice what muscles created that little bit of lift off the floor, send more to those muscles to try to rotate the thigh further without letting the pelvis jog forward. Slowly lower to tap your foot to the floor, and then pop it right back up to that height that you were able to find. Good. And back down. Good. Keep working away at this. 45 more seconds. Keeping your arms really heavy into the ground to mitigate any forward motion of the pelvis. The muscles in your torso are the ones that are going to keep your pelvis still. Nice. Good. Now Hannah's getting quite a bit of lift from here, so I'm just going to provide her with a little bit harder task that she can't see. Oh, there it is. Here we go. Last couple. 15 seconds of high quality work. And anything we'll do here, a book, a couple books, last effort. Hold that ankle up. Good. And lower it all the way down. Good. There we go. Okay, nice. Let's go ahead, turn it over to the other side, and we'll finish up on this hip. Okay, bracing forward. So on this side, this left arm now is the real critical one to help her stay braced through the midsection. So just start by pinning both hands heavy into the floor. Keep that plank feeling. Start to think ankle light and go slow at first to really make sure that the motion is all at the thigh and ankle and nothing happening at the pelvis. Good. And slowly lower to tap the floor. Pop it right back up. There we go. Good. Down. Each rep, try to make the ankle lift a little higher, but don't try so hard that other parts of your body start to get involved. You want to direct your effort rather into bracing to keep your body still and only moving the part of your body you're trying to move. In this case, that back hip, that back thigh. There you go, Hannah. Good. Last 15 seconds. Making sure to not let your ankle just flop onto the floor. Hannah's doing a great job of smoothly lowering that ankle, giving your brain as many inputs as possible. Slowly lower and you can leave it there. Nice. All right. Very nice work, folks, and have a great rest of your day.